Welcome to our Friday Facebook Live talking about COVID-19 and all the things you need to know to be healthy in Berrien County. We're going to remove our masks so that you can more clearly hear us, read lips if that's something, an accommodation that you need. So again, we're grateful that you've joined us here. We do want to start off this video really addressing some of the serious things that our community and our nation are facing. So I'd like Under Sheriff Height to maybe get us started.
Sure. On behalf of the county and obviously as a law enforcement agency with the sheriff, we are sickened by the death of George Floyd at the hands of the 4 Minneapolis police officers. We condemn those actions that led to his death. We also support the right of individuals to protest peacefully and will protect those rights for them to do so. I also want to acknowledge that we're very thankful in our community. There was a protest last weekend that was very peaceful, and we want to applaud that, and we stand with their message, and we do not condone in any way or any manner the use of unreasonable force by any police officer. We'll continue to work for the people, and we strive every day to earn and maintain their trust, build relationships, and improve our communities. But as we move through this, we also want to talk about the seriousness of COVID-19 is still there. So as we are outdoors and doing that, taking the precautions and protecting yourself and others from the spread of COVID-19.
Yeah. Thank you for that. And Dr. Hamill, what would you like to add?
Well, in healthcare, it breaks our hearts when we see people suffer and when we see people die. And it also breaks our hearts when we look at the health inequities that systemic racism has bred across the country. And those things really, really matter. You know, at a time like this, we are listening as carefully as we can. We're learning every day. And we commit to act, to do things that are going to help improve the health and well-being of our community. And this is a time we should all come together and focus on these very important topics. And we are absolutely committed as Spectrum Health Lakeland to do that. And of course, to work with others to do that well in our community.
Yeah, and I think it's really important. In public health, we are well practiced in trying to go further upstream and understanding the why. And as we talk about, there are health inequities and there are senseless acts of violence that happen, and it's important for us to continue to be asking why are we going further upstream. I'm heartened to see that we do have people in our community who are raising their voice to ask some of those questions, ask why, utilizing their constitutional rights to peaceful protest. And if anything we've learned during the course of this pandemic, it's that we can make extraordinary efforts and sacrifices understanding that life is valuable and that we can make attempts together to preserve as many lives as possible. We've shown that we can band together to protect our collective health, and we've seen up close how much our lives are intertwined with one another. Our fates are tied up in each other. What's going on with some of us does have an impact on all of us, whether or not we readily see it. These are really important things for us to continue to keep in mind as we continue charting our way through a new and ever-evolving norm. And we found out earlier this week, part of our changing norm came through some changes to the executive orders that more things are reopening. But before we start talking about reopening, I'd like for us to maybe just take a moment of silence to honor the memory of George Floyd and others who have suffered in the same way. All right, thank you. So I'm gonna turn it over to Under Sheriff Height to talk to us a little bit more about reopening, what this means for us.
Yes, so we've talked some. One of the major things in the county is the courthouses that have been closed to the public. Besides, some very specific items. The court is a little different. They're in a 4-phase approach that is outlined by the Michigan Supreme Court and the State Court Administrator's Office. So right now we're in phase 1 of that, which really didn't change anything from the public's standpoint or public access. I know the courts are working very closely with the health department because part of moving in those phases is where our numbers are and where we're at with the data that's there. So there is hope that on June 15th, the court will be able to move to phase 2, but understanding phase 2 really affects the employees that will be able to come there. It still doesn't really open up the public access. They'll continue to do more files, but they're going to do those remotely. And as we move forward, phase 3, which would be where we can open more things to the public, is kind of projected not probably till July 6th. But understanding all these are dependent on the data, if we get spikes or that, it could revert back. So they're under a little different phase approach than we see. We know the governor then reopened us to a phase 4 in that stage. And then this morning opened up for regions 6 and 8, even a little more. So just a reminder for us, we are not in region 6 or 8. So our indoor gatherings and outdoor gatherings still have stayed at 10 for an indoor gathering or 100 for an outdoor. What you may read about 6 and 8, she has expanded that. That's a good sign for us going forward. She talks about over the next couple weeks that may open that up.
And there's a point of good news in there.
There is.
For those of you who can maybe see closely.
First, not me, my hair is very easy to do. I have low maintenance when it comes to that. But June 15th, statewide, she has opened up hair and nail salons. So that is good news for those that are blessed to have hair. So.
And for those who have been anxiously awaiting opening their businesses and really trying to get back to work. So that is encouraging news. So.
And I'm married to a hairdresser, so that's why mine stays.
Well, Dr. Hamill, we know that Spectrum Health Lakeland has been really open and ready for us in meeting our medically necessary care. Do you want to talk a little bit more about what some of this means and some other things you're thinking as you're continuing those operations?
Certainly. So certainly the governor's recent order also liberalized visitation a bit, and it has been so hard to tell visitors no for these last number of weeks. I mean, they are such an important part of our patients' well-being. But to care for them safely and to make sure that they weren't exposed when they were there, and they, of course, were not exposing others, is something just take a little time to come to grips with. We're working hard to make it safe for visitors. There's still going to be some restrictions in terms of hours and number of visitors, but we are making a path back for visitors across the organization. Obviously, you're a pediatric patient, you had family with you, and if you were dying, we allowed very limited visitation. But we're trying to open those doors and make it a little bit feel like more like normal, and we're trying to do it safely. So be patient just a little bit. We won't have families of 4 or 6 join somebody in a room. That's not going to be possible, but we certainly will encourage visitation. We also are doing essentially all the services across the organization, and have found ways to do that as safely as we possibly can. We're still promoting virtual visits. That is absolutely the safest way to get care that lends itself to a virtual visit. But otherwise, we've opened up the facilities, and I think that's going well. Please, if you have healthcare needs, it's time to care for those needs.
Yes.
You can postpone it for a week or maybe a month. You can't postpone those things indefinitely and not suffer.
Right.
So we want to make sure that we're there for you. If you have any questions or concerns, pick up the phone, call first, and we'll give you guidance. The other thing that's been exciting is the antibody testing.
Yeah, tell us
Antibody
about that.
testing is now up and running. We've done 250 of those tests. Wow. We have a hotline you can call if you want to potentially get an antibody test, 269-927-5100. If somebody's had COVID-like symptoms 10 days ago, but didn't get COVID testing and wants to know if you likely had the illness, and potentially if you want to be a plasma donor, it's really useful to come in and get an antibody test, and we can say, yep, you've been exposed and you can be a donor. Also, if you just got exposed to a real close contact with somebody with a confirmed disease, and you want to know if you have likely the asymptomatic variety of COVID, which we're seeing some of, that test will help sort that out as well.
Yeah.
So it's been very useful.
That's great news. We're really glad to hear this. Here at the health department, we're also starting to add more of our services, make more of our services available as well. So our sexual health clinics, our home visiting programs, they'd all been operating at a somewhat reduced level throughout the course of the pandemic. We were never closed all the way, but we're continuing to ramp up those services and offerings as well. So like Dr. Hamill said, if you have needs, you cannot continue to put them off, and we really are concerned about your health, so make sure that you call, get into whatever type of care you may need. So as we talk a lot about reopening, I think it's implied a little bit that the data trends we're seeing here locally, they're pretty good. We're pretty encouraged by what we're seeing. For those of you you're all following us on Facebook page, those of you on our Berrien County Health Department Facebook page, you can check out, we released for the first time this week, we've changed how we're doing some of our data reporting on social media. And so instead of doing some daily updates of the number of new cases and deaths each day, we're going to provide a bit more of a weekly trend analysis in that overview. So we issued that first document on our Facebook and Instagram pages today, so you can take a look and check that out. All of the data is still readily accessible on our dashboard, so that has been on our dashboard for well over a month, or maybe almost 2 months now at this point. Time's going really fast. It's hard to keep track. But the dashboard is still available on the county website and the health department website, so you can find all that information there. We'll be providing a bit more of a trend analysis on a weekly basis. It might take us a week or two to get all of the timing because to really get all the data and reporting periods to line up the right way takes a bit of work. So it might be earlier next week than Friday. We're going to keep working through all those kinks, but we appreciate you sticking with us.
Nikki, I have to interrupt 30 seconds.
Yeah.
You shared some interesting news with me yesterday. Something comparing Berrien County and testing and tracing across Michigan.
Yes.
Yeah, what was that?
So we've been able to get some data from the state of Michigan on testing and by county. So how much testing is happening in each county. And lo and behold, Berrien County has done more tests per capita, not necessarily number of tests, but more tests per person than any other county in the state of Michigan as of earlier this week. So it was a close race.
We've been working
two,
really close together to get that job done, and I think right along with that, all the tracing, I think those trend lines that you're talking about that have started to move positive are a testament when we're in this together and when we're collaborating every day.
Yes.
It is so helpful. And certainly the health department leaning into the tracing, we're doing a fantastic job, I believe, in this county with the health department leading that tracing effort to help limit that transmission. So it's been really helpful.
Yeah, it's been fantastic to see, and that test per capita is something that's used in the governor's data dashboard as making decisions. Are we moving through 4? Are we going to phase 5? All of those things. So that testing capacity really matters because it helps us be confident we're catching a large proportion of the disease that's out there, and that combined with our contact tracing can help stop those lines of transmission. So that is really important. Want to really give a big shout out to Spectrum Health Lakeland and Intercare Community Health Network. Done a tremendous amount of testing. Intercare has had their mobile unit out. They've brought testing to people because we know transportation continues to be an issue. Their partnership in this has been instrumental, and we're going to continue all of these good works. There are other testing locations in Berrien County, including the Walmart in Benton Harbor and the Rite Aid in Bridgman, and there are some efforts to make sure that there is a testing site in the city of Niles. The state is working to bring a vendor in to operate a site down there, so it will be more convenient for those living in South County as well, which is important. So I guess going back to the fact that so many different things are opening up and the weather's warming up, it's always good to talk about some things we can do to reduce our risk as we're getting together. And I won't put either one of you on the spot, but but I'm certain that at least one of us has engaged in a little bit more social activity, and maybe a backyard barbecue with some friends, or maybe seen a family member that doesn't live in our household that we haven't seen in a while. And all of those things are allowable. We can have groups of under 10 indoors, up to 100 outdoors. But I guess I'm curious, what are some of the things you all are doing to make sure you're staying safe in those situations and thinking through your risk?
So we've done that. We've opened up, from us, having a barbecue, but still maintaining the social distancing. That's still the most important part. We've said from the very beginning, that is the best defense we have, since there's not, an antibody in those. I will say have not been home a grandson yet. We're hoping for that in the future, but we still want to be safe about how we do things too. So we'll see our family members, but still social distance, when doing that. So.
Yeah.
I have grandchildren in my pool. Now, the chlorine level, I think, is high enough to kill those viruses. I'm hoping that's going to be
harder to spread the droplets when you're in the
water. It's a little harder to do that, and I'm not getting in the pool.
But yeah, it's good to see how we're all trying to adapt to this new normal. We're all trying to figure this out together. But again, just thinking through that social distance, just the number of people. Yeah, gathering of up to 100 outdoors is allowed. Is it right for your event? There's some things that you need to be thinking through, and how much can we actually maintain that social distance. I know one thing I'm looking really forward to is we have about 70 staff members here at the health department. We have an all-staff meeting scheduled for next week. We thought we were going to have to cancel, but we're all going to stand 6 feet apart in the parking lot and just at least all be in the same place for the first time in months. And I think that's really important.
It is important.
So I guess at this point, we're going to see if we've got some questions that we can answer. Are there questions that we're getting in the chat box?
But a question that we can ask is that why is it better to look at a weekly analysis versus a day-by-day case updates?
So we believe that the weekly analysis adds to the day-by-day case updates. So we are doing the daily updates on our dashboard, and we have continued to do that throughout the course of this whole pandemic. As we continue shifting gears, we're opening more things up at our health department. Staff time is getting pulled in multiple directions. It's most efficient for us to have all of our daily data updates happening on our dashboard that can be accessed by anyone, and then the trends actually provide more information than we were providing before and provide a bit more context. We're at the phase in the pandemic right now where what's going on weekly and how that's relating to each other is almost more important than what's happening on any one individual day.
Well, certainly as we look at the data, that's true. There's day-to-day variability that just doesn't, it's how many people are showing up for tests and whether it's a weekend or not. That day-to-day variability it makes it hard to make sense of. That week-to-week trend, I think, is going to be way more informative.
Yeah.
Yeah, I think it's the right thing to do.
Yeah, thank you. Do we have more questions?
Yes, so we know that COVID-19 is affecting all age groups, but we've seen more of a trend toward our older population. So what advice would you have for our older population who's not in long-term care facilities, and they want to get out, but they see how members of their age group are being affected, so they may be scared to get out?
Yeah, that's a really important question of how those, particularly older adults, but anybody with underlying susceptibility to more serious illness, that is a really big question that I think a lot of communities and individuals are wrestling through. What amount of risk is appropriate for me? Clearly following the social distancing, wearing a face covering when in public and around other people, especially if that social distancing can't be maintained. These things are really important. Good hand hygiene, a lot of the things we've been talking about for months are really important. But we do know that there are older adults in our workforce, and as more sectors of our economy are opening up, older workers are returning to work, and that's wonderful. They add so much to our economy. We want to make sure we're protecting our vulnerable. Workplaces have an obligation with their health and safety plan to make sure that they've got those things in place. And a lot of it, I think, has to do just rethinking some of the daily activities of how can they be tailored a bit to continue to reduce risk. I don't know, Dr. Hamill, what you'd add to that.
I agree completely. I mean, there are things that we can do to take care of ourselves as a vulnerable population. We need to do that. What the governor is recommending, of course, is for the population in general. If you have twice the risks, you need to be twice as careful, in my view. I mean, it's just that simple. And so even if you're an elderly person going back to work, or somebody with diabetes and hypertension, which we know adds to the risk, you gotta make sure your surfaces are clean. You have to make sure you're not around people that are sick. You have to be really hand washing and covering your face. Those things are so important. And if you have elderly folks in your family, do their shopping for them. Do other things that might expose them to risk to make sure we're taking care of our most vulnerable. Be very careful not to use what the governor recommends for everybody and apply it to our most vulnerable. Those most vulnerable need more protection, I believe.
And the face coverings, even when people who may not have those serious risk factors, when all of us are taking those precautions, we do, in wearing a face covering, that does help reduce the risk of transmission. There are, it's not exactly known what percentage of people who are infected are asymptomatic carriers, but the more testing we do, the more asymptomatic carriers we do find. That is an increasing risk of transmission. So even people who might feel healthy and appear healthy do have some risk of transmission. So it's important to continue taking those precautions even if you feel well, and that's another way that we can look out for our collective good with our older adults and others that are more vulnerable.
As businesses are starting to reopen, and I mean, as a business owner, I'm looking at how to keep myself safe, how to keep my employees safe. So where can I go to get those types of resources to know how to move forward in this time?
Yeah, that's an excellent question. And as we continue moving through phase 4 and hopefully into phase 5 in the coming weeks, not yet, more and more businesses and workplaces are trying to figure out what are the best practices so they can protect both customers and staff members. So BerrienReopens.org is a website that has lots of reopening documents that are local. They're specific to Berrien County. There's sponsorship and information from the vast majority of the chambers of commerce in this area, as well as Connexus Group and Cornerstone Alliance, as well as the health department. You can find workplace reopening guidance almost everywhere. It seems like every group has come out with some sort of guidance, but BerrienReopens.org can be your one-stop shop that's got templates for the health and safety plans that are referred to in the governor's executive orders. And if folks are looking for a little bit more technical assistance, want to talk through a really specific issue, they can call the Berrien County Health Department. If you get started at our hotline, which is 1-800, I haven't said this number in a while. What's that hotline number, Chioma? It's 1-800-5.
It's like 855.
It's 855, and I would.
We'll put the hotline number in the chat box.
But while we're getting, I just want to say, as a county, another thing to be very proud of is, as you mentioned, we have several chambers working together with Connexus, the Berrien County Economic Department. So a lot of effort went into getting that and making it specific to Berrien County. So again, we are very fortunate to have the cooperation. Just as we've seen from our health officials, we have that from the business community and chambers to work together. So it's a great resource for businesses that are looking and just kind of verifying, am I doing it correctly?
Right. And the main thing that I've been making sure businesses are aware of is PPE, like masks and gloves. There's a place for those, absolutely, but PPE can't be your first line of defense. It should be your last line of defense. So having the social distancing, doing the screening to make sure sick people are not coming in, sick employees are not coming into work, all of those things should be first lines of defense so that it doesn't come down to being dependent on your cloth face covering or gloves or something like that.
We have some questions about can anybody get an antibody test? So what are the restrictions when it comes to antibody tests?
So the antibody test is one that is not included in, you get this test for free, by any either state or federal government's proclamation. It is something that there is insurance coverage for most folks. And making sure that's done appropriately. If you don't do it appropriately, we're not spending that resource in the right way. So that's one you'd call your physician or your healthcare practitioner, and they would give you some guidance and see that it gets scheduled and ordered.
Yeah. All right. Well, I think that's all the questions that we have for today and that we have time to answer. I want to again thank Dr. Hamill and Undersheriff Height for being here with us. I'm Nikki Britton, Health Officer at the Health Department. We're glad you've stuck with us and you're continuing to find guidance from us. We look forward to continuing to serve you. Thanks.
Thank you.